I'm always happy to join you, Chris.
Now, you were in the middle of controversy last time we had you on. They were saying they had to get rid of you. You were saying, I'm telling you, they told me to manipulate data. I'm telling you, they're not being straight about the data. Now you're going to track it yourself. Why do we need a dashboard that tracks it nationally? What will that mean for us?
Unfortunately, we've had no leadership at the federal level to embark on a mission to track cases in K-12 districts across the whole U.S. So I noticed that there was a gap there, an information and data gap, and having the resources and the knowledge and the skill set I joined up with FanMango, who's a financial literacy nonprofit, and decided to fix it.
And how hard was it for you to do this, by the way?
Very hard. It's more work than any one person can manage by themselves. And that's why I was really lucky to find people to help me build this project, help find all the data resources that are out there and pull it all in. We're currently talking with potential contributors to add to this list of resources. So it is a lot of work.
Do you have any early indication of what's going on out there?
It's bad.
How do you know already?
Well, schools in Mississippi and Georgia, Alabama, a lot of places in the U.S. Southeast have been open since the first week of August. Governor DeSantis here in Florida issued an executive order that was overturned last week that all schools here in Florida had to open by today.
But he's litigating it, so the order stands, which is why they went back to school. I told them in the last segment, but just so they remember, you're a mom. And you've got a kid who's in Florida schools, so this isn't just a clinical interest for you. Is it true that in your home state of Florida, the governor has the schools not reporting cases?
Yes, it is. Duval County schools were ready to launch their own dashboard tracking cases in every one of their schools and across their whole district. And according to the superintendent there, the state stepped in and said, no, you need to ask us for permission before you even notify parents about cases in your school.
Okay.
But
let's say that that's a protective mechanism, that they're able to vet the data, make sure it's good data, no false panic. What happens when people ask to release the data?
They're told that DOH is working on the best route to publish this data in a way that doesn't compromise patient privacy. But all of these states that are using HIPAA as a shield to not release data about cases in schools aren't using HIPAA correctly. HIPAA is designed to protect an individual healthcare record that can be tied to a person. Mm-hmm. You cannot identify any single person by saying the number of, let's say, teachers who have tested positive across an entire school district.
Right, they're already putting out data like that about cases and who and where and how. They're just being now selective about this new category. Is it true that at some point this month, Florida actually released reports on COVID-19 cases associated with daycares, schools, and colleges, and then pulled them back?
Yes, they did. For 3 days in a row, one day after the other, they released a polished and finalized report that listed the number of cases in each one of those categories for every single county in the state.
And when called on it and asked about it, they said, no, we're taking them off. They're not finalized. What does that mean to you?
Correct. That means that I think someone was told to generate this report and upload it before all the ducks were in a row at the leadership level, and leadership didn't like what the numbers showed, so they pulled back on it and decided they're just not going to tell us anything.
What are you worried about as a mom with your kid?
That I'm not going to find out about cases in my son's school until it's too late for me pulling him out to be effective.
But all the kids are okay when they get sick. It's like 1 in a gazillion has something bad. Why doesn't that work for you?
That's not true. I've written obituaries for several of the kids who have died in Florida. I still remember their names, like Daquan Wimberly and Kimmy and Carson Lee Davis. I've written their obituaries. This is not something that kids are immune to. Over 3,000 children just in the state of Florida have been hospitalized because of this illness. This isn't just, oh, they get better. And people seem to forget children have been the single most shielded group since this started. We immediately canceled schools for the rest of the semester in March when there were only a couple of hundred cases in Florida. So what do they think starting schools when there's a baseline of 500,000 active cases is going to do?
I hope it doesn't look like the colleges. I mean, those scenes. And again, I get criticized for this. It's hard for me to blame the kids, man. You know, you have kids there in their college age. You're telling them they can come back on campus. What do you think they're going to do? That's why leadership is about making decisions that people aren't going to find popular. And it is amazing to me, Rebekah Jones, that you are putting together the national database and we don't have it at the federal level. Thank you for staying in touch. Thank you for the work you're doing, and good luck going forward for you and your family.